How do we choose where a breast implant is placed with a breast augmentation? So the options are under the chest wall muscle, under the pec muscle, or above that muscle but underneath the breast tissue or the muscle sleeve. So there are pros and cons to each of these approaches. With a submuscular breast augmentation, we tend to get a little bit nicer coverage up top so that slope of the implant is a little bit softer. It also has a protective effect when we think about capsular contracture, which is problematic scar tissue formation around the implant. Now, the downsides of a submuscular breast augmentation include probably a tougher recovery because the muscle is a little bit more bothered, and this incidence of animation deformity, which is where the implant moves when that pec muscle flexes. Now, subglandular breast augmentation or subfascial breast augmentation, which is on top of the muscle, has sort of the inverse pros and cons. It can be very natural looking, and we have more control of the position of the implants towards the cleavage area. It's a lighter recovery, but it can make for a higher incidence of that capsular contracture. Now, with this new line of Motiva breast implants, we may have a better profile when it comes to capsular contracture and above the muscle breast augmentation. Like with everything, it's so predicated on your goals, your body, and this is something you'll flesh out in your meeting with your plastic surgeon.